Welcome to today's episode of Healthcare in Focus. I'm your host, Ashlyn Asnarian, and in this episode, we're going to explore the critical truth mental health versus physical health. There is no health without mental health. Every day, healthcare workers like you treat patients for pain, fatigue, heart issues, or infection, but too often the invisible pain, anxiety, depression, and trauma go unaddressed, even though it's affecting recovery, adherence, and overall outcomes. Today, I'm inviting you to reconsider how mental health fits into your practice, not only as an optional add-on, but as a fundamental part of patient care. The divide between mental health and physical health. For decades, our healthcare system has separated mental health and physical health. This divide stems partially from the belief called the mind-body dualism. This is the idea that the mind and body function separately, but as we know from statistics and data now, that this is false. Researchers from the CDC show that 1 in 5 adults in the U.S. experience mental illness each year. That's over 57 Americans. Yet many of these individuals never receive integrated care. When mental health is neglected, patients often return with worsened physical symptoms, higher stress hormones, and even increased risks for chronic illnesses like heart disease or diabetes. Physical health is highly prioritized, well-funded, and data-driven. Mental health is often neglected, negatively stigmatized, and underfunded. This results in patients receiving incomplete care. The cost of separation. Here's the reality. While mental health and physical health are interconnected, funding is not. For every dollar spent on physical health, only a fraction supports mental health services, even though untreated mental health issues can rise physical health care costs up to 50%. This data comes from the World Health Organization. That means that a patient treated for hypertension but left untreated for depression is more likely to skip their medication, experience relapse, or return to the ER within 6 months. This is not a problem of knowledge, it's a problem of integration. A look inside of hospitals. Let's be honest, healthcare professionals are overwhelmed. Doctors, nurses, and staff face long hours, high patient volumes, and emotional burnout. Many report feeling undertrained and addressing mental health, not only because they don't care, but because mental health has been siloed from their education and daily workflow. This results in a pattern of treating the symptom, not the source. A patient might receive antibiotics or pain medication, but no screening for underlying depression or trauma, which could be worsening their condition. Even brief interventions like 5-minute conversations or a simple screening can identify risks early and prevent major complications early. Patient stories, patient scenarios. Let's compare two patients, both with chronic pain. Patient A receives only physical treatment, medication, rest, and physical therapy. Their depression goes unrecognized, and within months they stop therapy, relapse, and report a worsening pain. Patient B receives both physical treatment and mental health consultation. They learn coping mechanisms, manage stress, and complete their treatment. Their recovery time is much shorter, and they report improved satisfaction. These stories are true stories, just shortened. These stories reflect real data. Studies shown that patients who receive integrated care experience 25 to 30% faster recovery rates and higher long-term wellness scores. This is from the National Institute of Health. Biological connection. From a biological standpoint, the connection is undeniable. Stress, anxiety, depression elevate cortisol, suppress immune function, and increase inflammation, which all of those worsen physical healing. Mental health directly impacts the autonomic nervous system, affecting everything from blood pressure to digestive health. Treating one without the other is like fixing a flat tire without patching the leak. When we heal the mind, the body also follows. Practical solutions. Now let's talk about some solutions you can apply in your practice. Integrating screening tools. Using short assessments like the PHQ-9 or the GAD-7, which is a common mental health screening during physical checkups. It takes less than 5 minutes and can help save patients from mental issues. Collaborative care teams. Partners with mental health professionals, a shared treatment plan reduces patient confusion and boosts compliance. Continuing education. Seek CME modules focused on medical and mental health literacy. The more we normalize it, the more effective we become. Normalize conversation. Ask open-ended questions like, have you been coping emotionally? Simple, human, and powerful. Advocate institutionally. Encourage hospital leadership to include mental health integration and policy framework and funding. It's easy to feel that mental health isn't your job, but it's everybody's responsibility. When you check a patient's blood pressure, you're measuring their stress response. When you ask them about sleep, you're already opening a window to mental health being. As a healthcare provider, you have the authority to normalize a conversation and the power to change the outcomes. Remember, every small conversation contributes to a larger cultural shift. Compassion is the most powerful medicine. A need for change. So, what can you do starting today? Ask one mental health question in your next patient interaction. Encourage your colleagues to do the same. By valuing mental health, we can reduce readmissions, improve recovery outcomes, strengthen patient trust, and bring back humanity into medicine. Thank you for listening. Together, we can redefine what it means to heal.